The woman, obviously, as with all pregnancy choices, is very much at the centre of that decision making, but with a team around them. And it's about being very honest but supportive about the risks of various treatments or not having treatments and what impact that will have on her and her baby and longer term for her as well. We can treat, as you're alluding to, breast cancer within pregnancy in terms of we can do surgery, we can give chemotherapy. Timings will depend on whether we give it, and we can give it in the second and third trimester, but we try not to give it just before delivery. So that's why we would want a window before delivery. So it would obviously depend on timing. Very rarely we can even give radiotherapy. It's a balance. We do know, though, that if we can treat and then deliver nearer to term, actually that has a really good outlook from the baby's point of view. Whereas if we have to deliver very, very preterm for whatever reason, actually that can affect the baby. So women understandably worried about having operations or taking medication in pregnancy because of the impact on their baby. But we want to put them first, to put their baby first. And we know, as you say, with expertise that we've sadly but have gathered regionally and nationally, and there's national guidance on this, we can safely give some treatments that you wouldn't anticipate, because women understandably don't want to take anything in pregnancy that might affect their baby. But there are some times where actually having that treatment can help them and can therefore help prolong their pregnancy, and that can have a long-term impact on their baby in a positive way as well.
Anna, what would your message be to anybody who has been diagnosed and unfortunately in your situation?
It's a difficult one to say. Everyone handles it very differently. I mean, and everyone will find out at different stages of pregnancy as well. So, I mean, in terms of my experience from there, I just almost prioritised my children. I needed them just as much as they needed me.
Yeah. And
so therefore the kind of reason to fight and kind of get through everything was because of them a little bit.
They were your rock, really.
Absolutely, yeah. So, it was lovely to escape through them sometimes, to be able to just go back to a normal part of life if you could, and try and park it for a little bit and just experience everything through them. But yeah, very much kind of just take all the support that you can do from any friends and family, and just try and experience everything through them whilst you're trying to get through it yourself.
And I think it's not being scared as well to ask your friends and family for that help and that support when you need it, and not comparing yourselves to anyone else, because I always say there's no textbook on how to deal with it. You've got to do what's right for you personally, and what might feel right one week might change the following week, and that's okay.
Yes.
But like I said, honestly, I look at you today and I just think you're just so beautiful, and you've got your two little ones. How old are they now, if you don't mind me asking?
10 and 7.
10 and 7, gorgeous.
Ellen, do you find that cancer treatment sort of can affect future pregnancies in terms of that cancer treatment and that individual becoming pregnant after that?
So sometimes people will be on maintenance treatment, which their team may recommend that they're on for several years. And so therefore, if someone has had treatment for cancer and then is planning pregnancy, it's really important that they obviously speak with their oncology team. And we do pre-pregnancy counselling for women. And I will see women with the oncologist to talk about actually going into another pregnancy. There are some medications, obviously, that we wouldn't then carry on, particularly into the early stages of pregnancy. And so then they're making the decision as to whether it's right for them to pause that treatment. We usually would say we'd want them to wait a couple of years. Again, all situations are different. And then the oncologist will be able to advise with us whether pausing that would have a long-term impact on them or not, and what that impact would be. And therefore, again, it's for the woman and her family to make that decision. There are some treatments that may have affected their health in general. So there are some medications that, for example, we might need to do extra scans on a lady's heart to make sure that it was doing well before a pregnancy. If they'd undergone certain types of chemotherapy, usually it's absolutely fine, but we'd want to know about it before they undertook a pregnancy. So yes, again, it's that sort of planning and having in difficult situations a degree of control over that. I mean, it's not control, but their input into it, and having the right team with that experience to be able to advise them. And then understandably, having been through cancer and treatment, whether that was diagnosed in their last pregnancy or after their last pregnancy, or it's their first pregnancy, it's a huge deal to undergo a pregnancy having gone through all that they've been through before. So give them extra TLC to help them through that, and recognise that from a personal and emotional perspective, it's a huge deal to have a baby. It's a huge deal to have had cancer. Put the two together, as you've both articulated, it's massive. And so it's providing that support with them as well throughout.